So at the university, we're running an asymptomatic testing centre, and that's where you can come if you do not have any symptoms of COVID. So that's what, for example, if you have a fever, you have a continuous cough, or you have a loss of taste and smell. If you have any symptoms, there is also a testing centre at Surrey County Hall on Milner Road, which is called a symptomatic testing centre. And that is where you go if you are showing COVID symptoms. So the idea is that we're cutting the transmission risk by not operating the centres together. I mean, actually, many universities didn't run testing until DfE's scheme started, which was around the same time. So they were only, if anything, about a week ahead of us starting. So most universities started the testing around the same time, around the start of December. Our approach has been different to a lot of our sector peers because we wanted to embark on a local partnership approach with our local authority and our Director of Public Health, who we've been working really closely with throughout the pandemic. And we wanted to ensure that we could actually have flexibility of approach with our testing, so we could expand it to our staff, which we were one of the first universities to do, for example. So not just our student cohort, but making sure our staff were safe as well. Absolutely. So we worked really closely with the Royal Borough of Kingston, the Director of Public Health and her team, who trained us all our staff. We went to visit one of their first testing sites in the borough to learn from them. And that was fantastic because a lot of the training that you would get from DfE and the Department for Education or its government agencies is all online training. And that's excellent in many regards, but it doesn't give you that first-hand experience of what it's actually like. So we made sure all our testing centre staff went to the council site to learn how to be and to learn how we really talking to people and their experiences of actually having the tests. So I think they all found was very valuable. There's a lot of requirements to what you have to have in terms of the type of flooring you have, the type of space you need, also the ventilation you need. So there's quite a long list, as you would imagine. And we did feel the outreach centre was by far the best location, and it's very central as well. And it also allowed us to scale up. So when we started, we only had 6 testing stations going. And now we have 10, and we have space for more if we want to. So the outreach centre allowed us the flexibility and adaptability to ensure our approach is consistent with the demand that we have. It's more of a partnership, so we have ongoing dialogue and we understand what their pressures are, we understand what the needs that they have are. So it seemed entirely what we should be doing when they said that they did need that testing facility for key worker staff in the borough. And we have the space, we have the testing stations, and it just seemed absolutely eminently sensible that we should partner with them. So I would say it was very much a joint discussions and joint agreement on this. That's a really good question, and I think certainly the approach we have with our local authority partners, which allows us, as I said earlier, about the adapting our approach depending on demand. At the moment, as you correctly say, a lot of our students are not able to come back to campus and they're learning online, and we're having to reduce the amount of face-to-face learning we're doing because of government guidance. So that does mean that we have more capacity in the testing centre at the moment for key workers. However, when our students come back to campus, and when that will depend on government guidance, we will of course then flex the model, so we'll offer additional capacity to students coming back so they can absolutely have priority to access the testing. But it's just really adapting our approach depending on the demand and what the government guidance says at the time. We certainly, we have every intention of carrying the testing on, and I think certainly we'll need to carry it on probably until at least Easter time. Looking at how what we expect the guidance to do. I think what we are looking to do is to see what the position is when we get the latest government guidance update, which they're saying is due mid-February. But certainly we'll be carrying on testing until that point. And I think very much afterwards. So we can expect an announcement very soon on that. But we have every intention, as I say, of carrying the testing on, and we will be testing our students when they return as well.